So the food frequency questionnaire, we're going to ask them different food groups and if they're eating them daily or weekly. So an example would be, Lucy, I'm going to ask you a few different foods and I want you to tell me if you eat them daily or weekly. Do you eat fruit daily?
No.
Do you eat fruit weekly?
No.
Do you eat vegetables daily?
Yeah.
Do you eat vegetables weekly?
Yeah.
Okay, so in an instance like that, thank you, Lucy. She hates fruit for some reason. Then we would have a calorie count or a nutrient intake analysis. So if any of you are doing a um, food journaling app like MyFitnessPal, where you're recording your food, you have access then to a nutrient intake analysis where you can see on a daily basis how many calories you've had, how much vitamin D, how much fat, how much saturated fat through that app. Oftentimes in a long-term care facility or acute care facility, we'll see a calorie count prescribed if a resident or patient is having difficulty meeting their weight goals or their calorie needs. So basically what this is the nursing staff is assessing their intake on the meal tray, and they'll write down on their meal ticket the percentage of each of the foods that the patient consumed. And then the nutrition professional will collect those tickets and then calculate the amount of calories. We'll also see in acute and long-term care the intake and output record. This is helpful for beverages, so we can see how much fluid someone is taking in. One of the markers of our role is meal observation, especially in a long-term care facility. You want to go into the dining room and observe people on how they're eating during their meals. Look for people that are having problems chewing, swallowing. Look for that pocketing of food or taking longer than 5 to 10 seconds to move that food from the front of their mouth to the back. Look for that drooling or oral leaking that we talked about. That would be signs of dysphagia. Get to know your residents. This is an easy way to see multiple people throughout your facility. We'll want to ask them about cultural influences and religious influences and how that impacts their nutrition needs. You all did a great job on your cultural presentations, and I enjoyed learning about the different food beliefs and healthcare beliefs from those cultures. And then for some folks, we're going to ask them about living arrangement and their support system. Is there someone there that can help them do meal prep while they're not feeling well, etc.? So once that individual has been screened and their information is collected from the medical record and from the subjective interview with the patient, then we're going to start to do some more math. So we have an estimation of nutrient needs or the basal energy expenditure. We'll figure out their daily protein needs, which you all have been practicing, and their daily fluid needs, which you all have been practicing. So if we have a patient that is non-obese, okay, so they would have a normal BMI, we would use a Harris-Benedict equation to figure out their calorie needs. Okay, so you need to make sure you use the correct equation for males or females. And again, you need to make sure that you calculate their BMI first to determine which EER equation you will use. For the Harris-Benedict, you need their weight in kilograms and their height in centimeters. So typically the height in centimeters is going to look like 160, 180, somewhere in that range. If you're using a number like 1.65, that's their height in meters, and you figured that out by doing their BMI, but make sure you're using centimeters. And then you need their age in years. Now I'm going to skip ahead here a few slides and I'll go back there. But if we have a patient who is overweight or obese, this says obese, but I want you to use the Mifflin St. Jeor formula if they're overweight or obese. So our Harris-Benedict formula is just for patients who are of normal BMI, okay? With the Mifflin St. Jeor, after you have figured out their BMI and you figured that they're either overweight or obese, then you're going to plug their information into this formula. Okay, so we still are using weight in kilograms, height in centimeters.